Hello, and welcome to my presentation, Diabetes and Exercise, Diverse Treatments for Diverse Cases. So to begin, I want you all to think of a time when you have made a lifestyle change that really worked for you. Now, this could be anything. This could be like developing a strategy to help you cut a problem food out of your diet for good. This could be the time you discovered a new athletic hobby that you continue to enjoy to this day. Now, I bet every single person here has a story like that, several stories probably. And I bet they're all good stories. But if you think about it, I bet they all have one thing in common too. And that is that this change, whatever it was something that was made on your own terms in a way that fit with your lifestyle as it was already. Because, even if you want to become the picture of like perfect healthy habits, it's not going to happen all at once. And like trying to make it happen all at once is just unrealistic and will lead to burnout, as I'm sure we've all here seen and experienced. So this principle can be applied to the treatment of diabetes or the management of the symptoms of diabetes type 1 and 2 with exercise. I think you can probably get where I'm going with this already. So the prevalence of diabetes is a persistent and growing problem in North America and the world, having reached global epidemic proportions over the past 50 years. And it's generally accepted in the public consciousness that exercise can be a productive avenue of prevention and treatment, making it an extremely relevant topic for people who work in the fitness industry. However, public perception does not consistently match reality, and professionals must be properly informed in order to think critically about claims others in the industry may be making. So while current knowledge suggests that exercise is a proven method of managing symptoms and effects of diabetes, such as glucose levels and CHD risk, however, evidence is not entirely conclusive, and the effectiveness will depend greatly on the patient's receptiveness to an exercise program. Something can be improved by tailoring it to suit their needs. So, for some time, exercise has been a proven method of reduction and stabilization of glucose levels in individuals with diabetes. However, there has been extensive research into what the ideal program to prescribe is. So the benefits of aerobic training compared with resistance training are subjects of study, with the prioritization of aerobic training being associated with the most consistent improvements in individuals with type 2 diabetes as well as type 1. Studies also suggest that exercise intensity has negligible effects on the extent of symptom reduction, and that adherence is the most important factor in the successful use of physical activity for diabetes management. Now, this is great news, and it's knowledge that healthcare professionals use to their advantage, because you would think the reluctant subjects are generally more likely to adhere to a low-intensity routine than a high one. But are they? So this is actually more complicated than you'd think if you give it more than just a pause for thought. But first, I do have to give a disclaimer, and it is that adherence is not the only challenge in the management of diabetes through exercise, because lack of exercise is not the only cause of type 2 diabetes, and obviously it has nothing to do with type 1. As physical activity is not the only factor that puts individuals at risk for diabetes and other metabolic disorders and CHD, it can't possibly be a fix-all. And this is shown in the rate of improvement of these conditions among test subjects. So access to facilitators of physical activity are an important factor, as they are in any lifestyle change, but the underlying causes of increased rates of metabolic diseases and CHD are far-reaching problems that must be taken into consideration when attempting to utilize any tool against them. So while these health issues are epidemic in the population, change is often most enactable at an individual level, as a program tailored to the preferences and schedule of an individual increases their likelihood of adherence and therefore of improvement. So this study suggests high intensity interval training as a time efficient method of exercise, because an increase of intensity is not shown to induce negative effects. And they're suggesting that perhaps this should be promoted to young professionals who cite lack of time as their main reason for not exercising, because type 2 diabetes in particular now affects a huge range of people. It's not just like an old person thing anymore. Like, all kinds of people get it, and often younger people as well. And the prevalence of like high intensity interval training as a fad may add to its appeal among this group. Whereas with older individuals with more spare time, lower intensity regimens are likely to have a wider appeal. But as I said, it's important above all that a wide range of options are suggested, as individual appeal and accessibility really reign supreme. Like, you're going to have 18-year-olds who'd rather go for like a 45-minute walk, and you'll have 65-year-olds who want to try CrossFit. It does come down to the individual ultimately. So while it is not an infallible or simple solution, exercise is accepted in the academic community as an effective tool for the prevention and management of diabetes. Exercise programs must be tailored to suit the needs of individuals to maximize adherence. Fortunately, the nature of the effect of physical activity on metabolic disorders allows a lot of room for personalization with regards to intensity level and duration of exercise. Here are my references. Just got to go through that. Thank you very much for watching my presentation.